situation emerging in the NHS where more and more patients now are facing barriers when they're trying to access the healthcare they need and which they've paid for through their taxes. We have the longest NHS waiting lists in history. They've not come out of nowhere. There were already waiting lists of over 4 million people when we went into the pandemic, but things have got significantly worse in the last few years. This government, over the last 14 years, have made working conditions for NHS staff intolerable in lots of ways. And so lots of staff have changed profession or have left the country to offer their expertise to other countries where they'll be better supported. We have a situation where the capital infrastructure in the service has been woefully underfunded, and we now have an unmet repair bill in England alone of almost £12 billion. And some of these repairs that need to happen are situations that are posing significant risk to patients and staff right now and are not receiving attention. The service itself isn't receiving enough funding, and that is affecting the delivery of care to patients. And we now have the additional problem of this government taking steps to flood the healthcare service with staff who are not doctors. They're de-skilling the workforce, and they're throwing up barriers to patients being able to access a clinician when they need one. This means that when patients are calling up their GP surgery to see a GP, for example, they're often not able to get an appointment with a GP, and instead they're going to see a different member of staff, like a physician's associate. Every member of staff has a role within the NHS, and I don't think it's worth attacking any particular group for sort of not being good enough, but patients need to be able to access doctors when they need help. We need, as a country, patients and staff to speak up about what is happening systemically, because focusing on one part of this, like pay or underfunding or privatisation or the de-skilling of the medical workforce, is not going to fix the problem. What will fix the problem is recognising the systemic change that politicians are making, which is to undermine and dismantle the public healthcare system to enable a different system to be made in its place. They already talk about this publicly. There's all this talk about reforming the service, about moving to an insurance model, about private healthcare, and we're seeing more and more articles talking about the benefits of private healthcare for patients. The reality is patients haven't been asked, the public hasn't been asked. The NHS remains one of the things that this country is most proud of, and there's never been a public referendum held about any of the policy changes that have led us to where we are now, involving privatisation. And I think the time has come to hold politicians to account. We need to do that together, not in siloed groups. There's been a problem with divide and conquer in the media where junior doctors are scapegoated, or GPs are scapegoated, or lazy patients are scapegoated. This is something we need to push back upon now. Everybody, patients and staff, should be working together to hold politicians to account about what they are doing to the NHS. I heard about an example on Friday to illustrate this point from a GP who had heard from a patient who had been very unwell the day before and had gone to A&E. They were told they'd had an asthma attack, and they went home from the A&E department, and the following day they felt very unwell with different symptoms. And because the waiting time had been so long in the first department they had attended, they went to a different local hospital. The waiting times there were extremely long, and the patient self-discharged from the waiting room and telephoned the GP to let them know they were feeling extremely unwell and what had happened over the last couple of days, and asking for some medications to tide them over until they were able to go to the GP surgery the next day. This left the GP in an impossible situation because they weren't able to clinically assess the patient. The patient wasn't in front of them. They were concerned for the patient. The patient had chosen to leave the A&E department. And in addition to that, the only member of staff that this GP surgery had an appointment for the following day was with a non-doctor, a physician associate. And this doctor, who I heard from, had concerns about all of that. Patients in the UK should be able to access timely and safe healthcare when they need it. That is not happening in lots of cases right now, and it is time for us to hold politicians to account for everything they are doing. If you agree, could you share this video, please? Thank you.